Hello everyone, myself Dr. Ankur Khandelwal and welcome back to my channel. Today I'll show you a case of Morton's neuroma and how Morton's neuroma affect patients. So we have a 28-year-old lady who has come to us with pain in the foot while walking. The pain has been there since last 3 months, and on examination the pain is predominantly between the second and the third cleft between the two phalanges or the metatarsals, and the third and the fourth. So this is the foot, these are the metatarsals, and these are the phalanges. So you have metatarsophalangeal joints. So between these joints, in the interspace, the pain is typically appreciated by the pain patient in the between the second and the third and the fourth. So this condition is peculiarly known as Morton's neuroma. It is not a tumor condition, but it's a condition where the fibrous tissue, where the tissue between the metatarsals, they get fibrosed. There is fibrosis of the tissues between the metatarsal bones just at the level of the joints, that is metatarsophalangeal joints. Most commonly it affects the area between the third and the fourth metatarsals, right? But it can also cause pain between the second and the third area. And why this happens? Because of the fibrosis, the nerves get entrapped in the fibrous tissues. And what are these nerves? These are the plantar nerves which get entrapped, and because of this the patient get lot of pain while walking. The pain is more in the dorsal part but also on the ventral part, right? And we can see these findings on ultrasound. So I have taken this linear probe of the ultrasound, and I'm placing it in this fashion, right? And now I can show you on the screen. This is the first joint, metatarsophalangeal joint. This is the first joint, right? Can you show here? I'm placing it this way, and from medially to laterally now I will move my probe like this. I will move my probe so that you can see on the screen. This is the first joint, metatarsophalangeal joint, right? And this is the tissue between the first and the second metatarsophalangeal joint. Can you see these tissues are well open up? These tissues are well open up, and now I am moving more laterally where I can find the second and the third joint, right? Third joint. Now if you can compare this tissue, these tissues are so well opened up, but here you see these tissues are a bit congested. It looks like fibrosed. And now this is the third and this is the fourth, right? This is the fourth. See, this tissue, these have become typically very fibrosed. I will show you the comparison again. This is fourth. If you come back again here, see these tissues are so well opened up, right? This is not very adhering, but here if you see this one, these tissues, they are very well fibrosed and thickened, and because of this the nerves get entrapped. As I move more laterally, so this is the fifth one. Again, if you can see, these tissues are opened up very nicely. These tissues can be appreciated, and if you compare here, there is thickening of the tissue, and there is thickening of the tissue here there is thickening of the tissue here, that is between the second and the third and the fourth. Again, it's very nice on between the second and the first. So what we do in the first sitting, we will just do some hydrodissection of the tissues between the second and the third joint and third and the fourth joint, right? And we will give some anti-inflammatory for few days. We will give some anti-inflammatory for few days. If the patient responds to this anti-inflammatory, well and good. If the patient doesn't respond to this hydrodissection and anti-inflammatory, we will then give steroid injection subsequently, right? So I have taken 3 ml of normal saline and 3 ml of 2% lignocaine and made it 6 ml. In each space I just hydrodissect with 3 ml. So you can see on the screen, this is my needle, right? So this is what I am doing. This is some hydrodissection, right? I am opening up the spaces so that the nerves get free. That the plant, see, I am opening up all the spaces. Can you see? Can you see? Can you see how nicely I am opening up the spaces? Okay. Now I will move to the space between the third and the fourth. Right here. Again I'll open up here. I'll try to see. This is opening. Some hydrodissection going on here. Like this. Pause. Pause. Again. So we have done hydrodissection, some opening of the tissues, right? So this is how we do hydrodissection in Morton's neuroma. Thank you for watching the video. We'll come up with some more informative videos.